this is a culture that needs to be gone from healthcare. We need to be able to give the best care possible to our patients. Their lives are in our hands. We have to make for sure that they make it from point A to point B. So medication errors result in thousands of deaths each year in healthcare. And according to the Journal of Emergency Medical Services, a medication error is defined as any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of a healthcare professional, patient, or consumer. You know, this is something that we need to think about. You know, it's our job to make for sure that the patient is safe, and we need to make for sure that we're using our knowledge to the best of our abilities. So what is the problem here? Is it deliberate defiance from healthcare providers, or is it just inattention to detail? We need more than one control to fix this problem. It's not going to be just changing one issue. So with medication errors, we need to ask ourselves these questions. You know, where do these medication errors happen? You know, how often are they happening? What are the outcomes of these errors that are happening to our patients, and what are the causes? So with the ARIVAC system, the most frequent medication errors were related to the use of ketamine and fentanyl. We need to ask ourselves, you know, all of these questions that I just listed, and we also need to figure out if it's in the field, if it's just in the aircraft, or if it's the time of day that is mattering. So we need to make for sure that healthcare providers are following policy and procedures. With ARIVAC, there are medication protocol standards of practice, there's crew rest, and there's pain management protocols. And we also need to ask, why are the crew or healthcare providers deviating from the protocols? If the crew is continually deviating away from the written protocol, then an analysis needs to be done to see if the protocol needs to be changed. This allows the policy and procedure to stay up to date for the standards of practice and gives opportunity for improvement for better patient care. We need to understand why the crew is also deviating from the policy. You know, is it because they feel like they need to give a different dose because this patient is needing a different dose, or is it because they don't know what the protocol is? So this is part of the post-intubation management. This came directly from the protocol. I felt like this was important because this is something that needs to be posted at the bases. You know, this needs to be in their eyesight all the time. They need to recognize this, and they need to know it by heart and by soul, really. You know, I know every patient is different, and I've personally never been on the back of an aircraft. I don't know what they go through, but if there is a policy, someone else has been through it, and they have written this policy or procedure for a reason. This is also part of the pain management protocol. It's the RAS score. You know, this protocol talks about the common medications that are used in the back of the aircraft and in the field. You know, this is important. That way the flight crew understands what they're medicating. So they need to be very, very familiar with this scale. So I brought up crew rest as part of the medication errors because this is very, very important. If the crew is exhausted from too many flights, or you know, they've done too many hard flights, or maybe they just had a very, very difficult flight, you know, this is very important that they get the rest that they need. They need to have their timeouts. They need to be able to prevent safety hazards. There are guidelines in here for fatigue and flight statuses. You know, there are different ideas to how to give the crew rest, you know, staffing relief, to help prevent any impaired judgment or ability, because we need to be able to give the best care. So the goals of this presentation are to help prevent medication errors, to have great patient outcomes, have compliance with the crew to follow the protocols and procedures, and then great communication. Communication is going to be the best for everyone around. We have to remember that failure is not always bad. Sometimes it is bad, sometimes it's inevitable, but sometimes it's good because we can learn from it. And we have to make for sure that everyone understands that this is not a blame game. You know, that anything goes attitude is not an acceptable practice. Noting success and embracing failures are lessons that can be learned by everybody. And then being self-serving or superficial is not a productive attitude. Failure can coexist with high standards. Being in healthcare, we have to have high standards. And there is going to be failure, but that's how we learn to make our standards even higher. And not all failures are created equally. We need to be able to learn from our failures. We need to learn what is preventable. We need to learn the complexity of the situation, and we need to gain intelligence from the situation. So reasons for failures to happen. So as I have listed, there's defiance to policy and procedure, inattention to detail, lack of ability or knowledge. There's process inadequacy, task challenge, maybe it's too hard. Process complexity, uncertainty, and, testing. Maybe they don't understand what is going on. So preventable failures are the high volume, checklist, making for sure everybody knows the checklist, what to do, routine operations, proper training and support. Those are going to be the key things to help prevent failures. And then sometimes failures are unavoidable. That is usually related to uncertainty or averted best practice. So if somebody is not doing their very best. So this came from Ames. It's the common themes of risk, and this is the 10 patient safety topics this came from the article, from the 10 patient safety topics that will move EMS forward in 2006. So, these, lack of teamwork. If we don't have teamwork, patients aren't gonna get the care that they need. Distraction, lack of training, lack of standardization, compliancy, fatigue and tiredness, negative culture of safety, lack of communication, protocol deviations, and poor system designs. I know I keep repeating myself, but this is what everybody is saying. We have to all get on the same page. And culture is a big thing. So we need to develop a culture where people feel like it is safe to speak up. They need to be able to feel like they can help create that safe environment, have the openness and collaboration with all of the people involved, have a good open teamwork relationship. They need to detoxify what failure means. So what that means is to take the negativity out of failure and then help spread the knowledge and understanding. And it's okay to be the skunk at the picnic. And not everything is black and white. There are variations to situations that cannot always be seen. It takes courage to speak up and help create the change. So with monitoring medication errors, we need to be able to track each base. We need to be able to look at anything out of the ordinary, immediately investigate problematic situations, and inform other bases of the problems to prevent it from happening to others. In order to do any of this, we need great communication, and we need to develop that culture. And we need to remember that this is not a rigid hierarchy. Everybody has the ability to speak up. Make for sure that everyone is aware that they will be heard. We need to know that the mistakes that are being made so that we can learn from them. This is not a blame game. This is not pointing fingers. This needs to be an enforcement of standards of practice. It takes courage to confront not only your mistakes, but others too, because you have to work with them. So this came from page 21 through 23 of the ARIBAC Life Team Safety Management System. This is a formal system that identifies risk. There are 5 processes that are laid out in the handbook that are necessary to control the risk. So we need revision, development, we need identification of hazards. So I wanted to bring up, I was able to gather some data over the last 2 quarters from 2015 and 2016 of medication errors. And for 2015, the total was 28 medication errors that were severe. And in 2016, there were 66. So that was for a total of 1 year, 2 quarters. So that was 94 medication errors that were reported. So how many of those went unreported? That's the question that we need to ask. So on page 25 of the ARIVAC Life Team Safety Management System, this tells us what we need to do to reassure safety assurance. So this is the function of the process to evaluate and continue effectiveness of the risk controls developed in the risk management phase. This is to make sure that there is no deviation or devastating problem that has been happening in relation to any new solution that has been brought to the table. So what we need to do is we need to assess the risk, we need to apply the risk control, monitor and review, and then assess for any new risk. That's pretty much what the last chart said. So this is on page 24 of the ARIVAC Safety Management. This goes over what a high risk, a serious risk, moderate, minor, low risk. So when you're looking at your risk, you have to decide where you're comfortable having your risk. Most people like it in the green. Yellow is usually, as you can see, moderate, it needs to be fixed. 4 and 5 have to be fixed. So safety behaviors. So there are no simple solutions for preventing medication errors. However, instituting the best system and safety behaviors are important steps. There are processes that can help assist with decreasing the risk, beginning with ensuring the 5 rights that are followed. No matter if you're in the helicopter, you're in the field, or if you're in the hospital, the patient has to have the 5 rights of medication administration. I know it's different compared to the hospital. We have scanners, we scan the patient, we scan the medicine, that's another part of our safety net to make for sure the patient's getting the right dose and the right medication. Being on the back of the helicopter, you just have to depend on each other, and you have to make for sure that you know your policies and procedures. So these are some safety behaviors that we all need to follow. We need to cross-check prior to medication administration, double check with your coworker just to make for sure that you're given the right medication. There needs to be a culture of patient safety. That needs to be the standard. Encourage providers to contact medical control with questions rather than rely on memory. So if they're not sure about a dose and they can't come up with a solid answer, they need to find somebody who has the answer. And then report any adverse events, near misses, and unsafe conditions to identify system flaws to allow for learning. Simple ways to begin the culture shift. Leaders can create an environment in which daily aspects of the job are enforced. Discuss patient safety with any new job candidates, conduct daily leadership walkarounds, incorporate patient safety in the performance review process, display visible safety posters, having the policy and procedures up where everybody can see them, maybe little pocket cards or something like that. That way they have it on them. They need to start the meeting with a safety story or discussion. It can even be about near misses or even something that happened on a flight that needs to be discussed. That way everybody learns about it. Recognize and celebrate from great catches, and then measure your culture with a validated tool. Make for sure that you're able to determine the results, and compare it to others to make for sure that you are holding the standard. And managers, supervisors, base leads, program directors, they need to remember, don't shoot the messenger. If someone is coming to you with an issue, they feel like it is a valid issue and it needs to be resolved. So don't shoot the messenger, embrace it and take it on and try and come up with a great solution together. The end. Thank you.